Thank you.
Thank you, sir.
Paramedic Services Committee meeting to order, and ask if any member has a declaration of pecuniary interest. They declare it now or at the appropriate time. Seeing none, we'll move on to action item A, electronic ambulance call reporting and hosting agreement.
Thank you, Mr. Chair. This is a recommendation that a bylaw be introduced authorizing the warden and clerk to execute and update electronic ambulance call reporting system and hosting agreement between the Corporation of the County of Bruce and InterDev Technologies. Paramedic Services have had this contract with InterDev Technologies for the last 7 years. This service is key to the Paramedic Services fulfillment of its legislative reporting requirements to the ministry. The term of the contract is 5 years from March 31st, 2017 to December 31st, 2022. While the agreement is retroactive, it is by the company's design, as it is attempting to structure all of its contracts to be active on December 31st of each year. The pricing remains at $40,323.50 with a contracted 4% annual increase for the term of the contract.
Thank you. You've heard the recommendation. Do I have a mover and a seconder? Moved by Ann, seconded by Mike. Discussion? All those in favor? Opposed? Motion is carried. And two information items. Exemplary service is attached. Mike, do you want to lead us through that?
Mr. Chair, I will, and it's with the greatest pleasure that I bring to you the information that several of my colleagues have been able to or have been awarded the Exemplary Service Medal for Emergency Medical Services. This is not a long service medal, but an exemplary service medal, which requires the nominees to provide evidence to not only have they been practicing for 20 years of service, 10 of which has been in the field, but they have also worked off-duty to develop a resume of meritorious acts that is submitted for consideration at a provincial, national, and Rideau Hall review process prior to the medals being awarded. This is an exceptional honor, and this year it was awarded to paramedics Scott McAllister, paramedic Dan Erbschott, paramedic retired Glenn Smith, and paramedic retired Linda Isbester. These awards were given on September 28th, 2017 by Lieutenant General Richard Romer at the Ontario Association of Paramedic Chiefs meeting.
Thank you, Michael, and we officially recognize those people, Scott, Dan, Glenn, and Linda, for their exemplary service, and that will go on record with our minutes.
Thank you.
Received for information, and again, one more, Bruce County Paramedicine.
Mr. Chair, the paramedic service funding, or the community paramedic service funding, was applied for in a joint submission by Huron, Perth, and Bruce County Paramedic Services in the spring of 2014. In the fall of 2014, a joint funding agreement was agreed upon, and funding was provided to allow for the development of a community referral by EMS program, which was designed and delivered jointly by these three organizations. This training allows staff to evaluate clients' needs and determine if they have any needs for further care or home care support. The provision of this report would allow them to stay in their residences longer and with no need to call 911 for services. These referrals have been done in cooperation with the patient and are submitted through the Community Care Access Center for follow-up. While this program could be expanded, at this time we would have to do further analysis with regards to current pressures on local emergency departments and other associated benefits and risks, which would need to be completed to determine if this program should be expanded further. I would note that at this time, the outcomes of the program have yet to be published by the Ministry of Health and Long-Term Care.
Thank you. Any questions or comments regarding this? Yes, Ann?
Mitch and I went to a presentation on it, and I've been thinking about it since. But I'm very hesitant. I'm always wary of duplication. I know it's not totally our level of control, but from what I know about community care access and the bureaucracy so there'll be a bureaucracy between community nursing and then paramedicine and the jurisdictions. I think there's a lot of things that really need to be looked at, and so how does this change the role of community nursing? And I'd just like more information on the bureaucratic changes that are going to be made at CCAC, or is there just going to be a lot of duplication? I agree that what you've said is, I think the program has to be carefully looked at. And the other, because I've just seen duplication before, and sometimes instead of enhancing a program that's already existing, they create a new program that overlaps with the existing program. And also the fact of funding. Will it be downloaded to us? Will the funding be guaranteed? If they ramp up the program even more, will the funding be guaranteed? So those are my concerns. I just want to point that out. Okay,
thank you. And yes, Kelly?
Through you, Mr. Chair, just to respond to the inquiry, the Local Health Integration Network have been on a program of pretty substantial change for the past 8 months, and we too have reached out to get some additional clarity, and at this point in time they haven't been in a position to be able to share that. I can say that they have done a pretty good job of aligning the admissions process in terms of the long-term care facility that they amalgamated with the CCAC. In terms of the community paramedicine side of that operation, we have not received any update at this point, but we have sought one.
Yes.
Okay,
so
thank you. Yes, Ann?
So some of the things that the paramedics were doing are things community nurses were doing and have to do before you treat a patient almost, taking blood pressure, signs, et cetera, and so it's and making the decision to call 911 is sometimes up to the patient themselves, but sometimes up to the community nurse that comes in. So I think it has to be very carefully looked at.
Okay. Yes. So, Michael?
If I might respond, Mr. Chair, it is so true that community paramedic services, if it is to be effective, needs to be very well integrated in a surgically precise way into the healthcare system, where the bureaucracy it does nothing more than ensures clarity of practice. What we are doing now is simply making observations that may not be seen by any other member of the healthcare team to say that someone in a residence may do well by this or that, and connect with home care or other services so they do not need to call an ambulance to travel to the hospital. But as far as treating people at home, doing things that are within a paramedic scope, but may well keep them away from their other duties. This is a very careful measurement that needs full consideration of the medical side, the legislative side, and of course council, to ensure that there is a good return on investment of this work and that it is not duplicated, and indeed funding is supplied for where funding may be saved in other parts of the system.
Okay, are there any other questions? All right, we received that for information. And that is the end of the business on our agenda. Our next meeting is December the 7th, 2017, and I need a motion to adjourn. Moved by Ann, second by Robert. All in favor? Opposed? Carried.